Good afternoon, everyone. Apologies for the lateness of getting started. We had some, shall we say, technical difficulties along the way. I see we've got people joining, and let's give it a couple more minutes and we'll get started. Welcome to all who are
Good
present.
afternoon.
Hit that link again.
Good afternoon, everybody. Another minute before we get started. Rhonda, it's good to see your face, at least virtually. And
You as well.
And when you
Oh, I'm so tired of this man. He's
have a
in
critical
everything.
mass, feel free to,
Every job I've had, I have to see
and
this
get the
man, and he is
presentation
just
started.
relentless.
Someone
Yes. He's
not
just
muted.
cringy as hell.
Yeah, if you're not a presenter, please mute yourself. Please, you can participate and not disturb others. I'm glad to see some members of the community on the call, and hope this will be a valuable presentation. As we mentioned in the scheduling and the invitation to participate, HUD asks us through the continuum of care to offer this kind of training on an annual basis to the community. We realize a lot of this information is publicly available, but we appreciate the willingness of Rhonda and her team at the Durham County Department of Social Services to provide a presentation virtually, as well as to answer questions about these processes in Durham County.
Well, that's stupid.
So with that, I see Nancy, you have no audio. Would invite you to check your audio settings in your on your device. There is, at least on my screen, an opportunity to show captions. So that might be an option if you continue to have audio difficulties. Rhonda, I'm going to turn it over to you. Thank you.
Okay. Thank you all for inviting us. Today, we have staff that will be able to talk with you about our food and nutrition program, our Work First, and our Medicaid program. This is an exciting time for us because some of you may have already heard about some changes that will be happening after today in food and nutrition. So we will be sharing information and hope at the end that there are some resources that you will be able to share with us that we can take back to individuals that we are working with. Because one of the things that I think works very well in Durham is the community connection and the sharing of information amongst partners. So I'm going to introduce the teams, and I'll let them go in the order that they have prepared for their presentations. So for the food and nutrition and Work First, Latoya Chambers and Maria Fuller will present. Latoya is the program manager over the food and nutrition and Work First program, and Maria Fuller is one of the supervisors, and they'll give more detail with their presentation. And we have Nancy Santos and Erica Maddox. Nancy is the program manager over our Work First employment program and our Family and Children's Medicaid. And Erica is one of the supervisors that's on that team. So thank you all again for inviting us. And I'll turn it over to Latoya.
Well, good afternoon, everybody. Once again, I am Latoya Chambers, and like Rhonda stated, I am the program manager for Work First Family Assistance and Food and Nutrition Services. Along with me, I have my supervisor, Maria Fuller, who is a Food Nutrition Services Applications supervisor. And so if you just give me a second, I'm going to share my screen. And let me know if you can see it. Can everyone see my screen?
Yes.
Okay. Okay. All righty. So we'll go ahead and get started. And so as I stated before, as Rhonda stated, we will be providing information on the food nutrition services Services and the Workforce Family Assistance Program. Just to give you a little background, I created this chart to show you with the amount of applications that we received and processed from January 2022 to December 2022. And so if you can see at the bottom, Durham County received a total of 18,646 applications from January 22 to December 22. And so where you see the ePass and the paper, ePass is the online way that people can apply for benefits. And so 63% of our applications for FNS came in through on the online or the ePass portal, and 37% was paper. We also take applications face-to-face as well as telephone applications. We can receive faxed applications as well. We processed a total of 21,762 applications for that time period as well. And this is a huge increase. I was looking at the last presentation we did, I think back in 2021, and the numbers have significantly increased, as you all can imagine, just with the pandemic and the shortages with workforce. So we're feeling the impact as well. Okay. And now I'm going to pass this over to my supervisor, Maria Fuller.
Hello, everyone. I'm Maria Fuller. So we're just going to go ahead and get into the slides. What is Food and Nutrition Services, known as FNS? Food and Nutrition Service is a supplemental federal food assistance program that provides low-income families the food that they need for a nutritionally adequate diet, and benefits are issued via an electronic benefit transfer cards. You may hear them say EBT cards. So EBT cards is where families receive their benefits. What is Simplified Nutritional Assistance Program? I know that sometimes you hear the Food and Nutrition Program being called SNAP. But the SNAP program for North Carolina is designed for the elderly who's receiving SSI income. SNAP is a simplified version of regular food and nutrition services.
Okay.
I'm sorry. Hold on, Maria. I'm sorry. Sorry. Okay. And at the top, it's just saying SNAP versus FNS. So we're just going to do the comparison.
So yeah, so okay. SNAP versus Food and Nutrition Services. As I stated before, SNAP recipients are U.S. citizens who receive SSI, age 65 or older, reside in North Carolina, and they do not live in an institution. SNAP clients must purchase and prepare food separately from other people living in the home. So if you have an individual who's applying for SNAP, they cannot have a spouse that's in the home. They will have to apply for Food and Nutrition Services versus SNAP. SNAP are all one-person households. SNAPs are set amount based on their shelter expense. So if you have someone whose shelter expense exceeds $150, then they automatically get $196 in food and nutrition benefits. If their shelter expense is less than $150, their SNAP allotment is $156. And individuals who are FNS recipients, a person living alone or a group of people living together who purchase and prepare meals together. A child 21 years of age and under living with his or her natural, adopted, or step parents must be included together on the FNS application. Someone just put a question in. Once I finish this, I will answer that question. They reside in North Carolina and must be a U.S. citizen or a non-citizen lawfully admitted into the U.S. FNS allotment amounts are based on income in the home. So the question that was put in the chat, is this the amount that they receive monthly? Yes, for SNAP recipients, that amount of the $196, they will receive that monthly, or the $156. So there are different methods for applying. You can apply by ePass, paper application, face-to-face. You can also do the telephone. as well to complete an application. Just some reminders for applying and using EBT Edge. Clients can apply by submitting their application through the DSS mobile app. We have a mobile app, and here's the link that you can use to submit your application, and you can also use to submit verification that you're sending to your worker in order for them to complete the process of your application. The ePass allows the client to receive their own e-notices via email. So if anything is sent to the client, like a wage verification form, it can be sent by e-notice and it goes directly to the client's email. It also allows the client to track their application, and it also allows the client to upload documents. So if you apply online, once you create your NCID, you can do all those things pertaining to your application. The electronic benefit transfer, which is the EBT card, is a payment portal system for FNS. So with EBT Edge, it allows clients to check their benefit balance, and then say if they lost or their card is stolen, they're able to replace that card by visiting the website that's listed here at www.ebtedge.com. When you Okay, so before I move on to the next slide, the difference between SNAP and FNS, SNAP is dedicated for individuals that are 65 and older that receive SSI income. If they can receive Social Security and SSI, but as long as they're 65 or older and they receive SSI, they qualify for SNAP. Sometimes SNAP is not the better benefit for the client. FNS may be the better benefit for the client. Yes, there is a fee if someone loses their card. I can't remember off the top of my head the amount that is charged off of their benefits, but once I get the amount, I can let you know the exact amount that's charged if they lose their card and they get that charged to off their account. Best practices for completing the FNS application. When you're completing the FNS application, it's called the DSS 8207. We ask that the application be written out completely. You're filling out everything that's on the pages, especially page 8 of the application. It needs to be completed just how it is here on this slide. We need your signature, first and last name, your address, your telephone number, because what happens is if you do not sign or fill out this page 8 completely and we can't get in contact with you, it is considered an invalid application. So that means that one, your application has not been submitted, and potentially if we can't get in contact with you, it could be a week or so before you call us to let us know, and you will have to reapply all over again. Yes, voter registration is included on the app. So yes, that is a great thing. So this form here, we send out to every client. So this is the food and nutrition verification form. We send this out to let the client know these are some of the potential documents that are needed to process your application. So this is a way to get the client to start gathering their documents before we send the actual form to say, hey, this is all that we need in order to complete your case. Are there any questions related to any of the slides so far other than the ones that I've already answered? All right, I'm gonna hand it over. Yes.
Will you share how people can access ePass and what is ePass?
Yeah, so there is a video, I can share a video of how to access the ePass. It's a website.
We have the link at the end too, the ePass link, but go ahead, Marie, I'm sorry.
Oh yes, so there is, like Latoya was saying, there is a link on this slide as well, but the ePass, you can go to the ePass website, and that's how you can complete an application. You can complete an application for food and nutrition benefits and now work first cash assistance. The website is epass.nc.gov.
And it stands for Electronic Pre-Assessment Screening Service for EPAS.
Yes. Yes. And there on their website, there is a video to show you how to use the website.
And one more thing too about the website with the EPAS, there are other languages as well that people can access the EPAS. So if you don't speak English, I think they have it in Spanish. So there are different languages as well so that you can access it.
Right, and going back to the forms, so for the most part for our forms, we do have Spanish forms, so we do send those out as well as English. Some of the forms are in other languages, but not all of the forms.
Okay. So then I'm going to talk about skimming, and this is pertaining to the electronic benefit transfer or the EBT cards. So skimming, we've started seeing an uptick with skimming, which I'm gonna get into in the probably in the last couple of months. So card skimming is a method of obtaining personal data accomplished by attaching a device to a point of sale machine, personal identification number pad to steal card numbers and other information from credit, debit, and EBT cards. And so we've been having clients that have been calling us and contacting us about their benefits that are being skimmed. And what I do want to just let everybody know that the EBT cards are not just pertaining to FNS or food nutrition services. It also houses benefits for work first family assistance as well as special assistance too. So I just want to point that out. So with the skimming, and we have sent information, we have information that we have composed for our workers, because we know with these calls to give some guidance to clients as to what they can do to protect themselves. So what they can do is they can check their EBT accounts regularly for unauthorized charges. You can also check your EBT card by visiting EBT Edge. Once again, they need to check card reading machines in stores to make sure there's nothing suspicious overlaid or attached to the card swiper. They can also block out-of-state and online purchases, from their EBT Edge accounts or the mobile app. They could select a difficult PIN. While this may not prevent card skimming, it is recommended as a safety practice. Also, changing the PIN to the EBT card regularly using a new number each time will also help prevent card skimming. Okay. If benefits are skimmed, if you have people that are reaching out to you, asking you what they need to do, there is a link that they can go to that shares tips for consumers. They can contact us or contact the 919-560-8000 to report a need for evaluation of replacement benefits. They will need to contact law enforcement to report the stolen benefits. They can call the EBT call center at this number, the 1-800 number, to request a new EBT card at no cost. However, note the new card will not contain the funds that were stolen from the previous card. Sometimes clients may call directly to the program integrity, which we are highly telling them they don't need to submit a fraud referral for card skimming, as the program integrity unit cannot investigate anyone other than the recipient. I do know another thing with the skimming, they do have to file a police report. If I'm not mistaken, that just helps with the process. The state is coming up with a plan right now as to how we're going to issue replacement benefits, but we haven't heard anything further from that. So we've just been keeping a log of clients that have been contacting us about their benefits being skimmed. Okay. With the onset of COVID, our programs had a lot of different things put in place to help ease some of the practices that we have in place, and also to allow more people to be eligible for benefits. So I don't know if you are aware, but the federal PHE, the public health emergency, will be ending. The federal government, and as a part of the PHE, FNS recipients were getting 2 different allotments. So they were getting their regular allotment, then they were getting the emergency allotment during the month as well. So those extra or the emergency allotments will be ending. So the federal government made the decision to end extra FNS benefits for COVID-19, with February 2023 being the final month. So this is the final month that they're going to get those extra benefits. Benefits will go back to the current regular allotment starting March 2023, which is tomorrow. Neither the North Carolina Department of Health and Human Services or the local Department of Social Services has any control over this change. Current FNS recipients do not have to reapply once emergency benefits have ended. And because of this, we already know we have already put things in place, provided information to community partners. We know that we're going to probably see an influx of calls of people calling, wanting to know about their emergency allotment. So right here, and this part right here is on our intranet site itself, just telling you about some different or some other organizations that can help out with resources as it pertains to food. So there's the QR code. And so we just wanted to let you all know that we are aware and that there are additional benefits or additional resources that can help people who may be in need of food. Now, we do have a section generated for just frequently asked questions. If the question that you may have is not here, that's fine, we can answer it. So this is just some of the frequently asked questions for FNS. Who can apply for FNS benefits? Any individual in the household may apply for FNS. How to obtain a current paper application. If that's what you so choose to desire, you can come to our office, which is on 414 East Main Street from Monday through Friday, 7:30 to 5:30, or you can call the agency at the 919-560-8000, or one can be mailed to you. Can you apply online? Yes. And once again, we're back to the ePass. There is also a link for Spanish-speaking individuals, and those links, we'll have those at the end of this presentation. What do I need to do to provide? What do I need to provide with my application? Primarily, you will only need proof of identity, but you can refer to slide 8 for further verifications where we showed you all the different, it was a sheet, a form that we had the different types of verifications. And even with that, there still may be some things that may not be addressed. So at any rate, we will always let the clients know what else is needed to process the application if anything is missing. How do I get a replacement EBT card? You can call the 1-888-622-7328 or contact 919-560-8797. Can I submit my application at DSS? Yes, there's a drop box located in our building at 414 East Main Street. There's one on the outside and the inside. I think the one is still on the outside, I think. Definitely on the inside. How can I apply for PEBT? So right now, there has not been any further guidance about the 2023 summer months for PEBT. So we're still waiting to hear about that. So once we get more information, we can definitely let you all know whatever we find out, and you all may find out before we do about the PEBT. What will be my allotment? This will vary based on information provided to establish eligibility. Each household is different. Each situation is different. How do I report changes to my application? You can call the 919, our main number, 919-560-8000, or contact your worker, or through the DSS mobile app. If I'm not a U.S. citizen, but my child was born in the U.S., can I apply? Yes. Each household member's citizenship and/or alienage status must meet program guidelines. How do I report changes to my active case? Contact our main number, contact the worker, or you can submit your change at the email fnschanges@dconc.gov or through the DSS mobile app. What if I need assistance with completing the application? You can call the main number, or you can call the 919-560-8541, and someone can assist you with completing the application. Can I apply for FNS benefits if I have a previous criminal offense? Yes, anyone can apply for benefits once again. Any questions about FNS?
You have some in chat.
Okay.
One of the questions was related
me see.
to fraud. I can answer the fraud question. So it just depends. So we do have a program integrity department, and they do those investigations when it's related to frauding your benefits. Some you can be disqualified from receiving food and nutrition benefits. Your benefits can be reduced. You can be permanently disqualified from receiving food and nutrition benefits if it is found that you have committed fraud. You also can go through the court systems as well, depending on what they see fit regarding the fraud that you have committed. Another question was PEBT. So PEBT stands for Pandemic EBT benefits, and with PEBT, it was given through the school systems, and that was just a temporary program to give food assistance.
Right, and we did not determine eligibility. That was solely based off of information pool from the Department of, from the schools, so it's like Durham Public Schools and the school system. So we didn't have, DSS didn't have any involvement with PEBT. Was there any other questions? Was that it? Okay.
Yes,
Just a comment. I'm glad to see the
Resident.
QR code worked.
Oh, yeah. Oh, 58 food. Oh, yeah. So that's good. And I see where someone was asking about SNAP versus FNS. Who was that? Someone was asking about the difference. Oh, Princess Smith, I can get that to you. Okay. Any other questions? And the 8 of the food pantries have closed. Okay, thank you. Good. Okay. So Workforce Family Assistance, or WAFA, which also is formerly known as, many of you may know as TANF, the Temporary Assistance for Needy Families. One thing I do want to make clear about the Workforce Family Assistance Program is that unlike Medicaid it's not an entitlement program. And so I just want to make sure that I point that out. So basically, North Carolina's Workforce Program is based on the premise that parents have a responsibility to support themselves and their children. The Workforce Program provides eligible parents with short-term training and other services to help them become employed and self-sufficient. It also provides assistance for eligible children whose caretaker is not eligible for benefits themselves if they meet certain kinship requirements. And we consider those cases as child-only cases, where they would just have that adult would just be the payee. Workforce provides monthly financial assistance to help meet the basic needs of families with children, such as food, shelter, and etc. Depending on which service that they get through WorkFirst, they get linked with an employment social worker who also kind of guides them with the job searches, educational programs, because the ultimate goal for Workforce Family Assistance is self-sufficiency for the family. It's like life after public assistance. That's what Workforce is geared towards. And you can apply for Workforce Family Assistance now through all methods, just like you can for food and nutrition services. You can apply through ePass, which is online. Now, as of December 19th, you can, for ePass is as of 12/19/2022, you can apply online. Prior to that, we can only take paper applications or do face-to-face. And so that's a huge change for the WorkFirst program, because we have seen a huge increase with WorkFirst Family Assistance applications, which is fine. But that just lets us know that people are going more towards, getting things online. So that's a good thing. Any questions about WorkFirst Family Assistance? Okay. And on this slide, we just have some contact information with all of our programs and our program managers. And then here are some other useful links that you all could take heed to. And this is also in reference to additional resources when it comes to food as well too. Some that we want to pay close attention to, I think people may tend to forget, is the WIC program, which is for women, infants, and children, that provides some nutritional services for that certain demographic. And we also have the policies, F&S policies up here, and then our DSS mobile app with the QR code. And the DSS mobile app, we really do push that with clients because it's real time. They can take a picture of an image. It's a free app, upload it, and it comes through. And we're able most of the time to get it right then. The worker can get it. And if they're needed, they can process it. So we really highly recommend clients using the DSS mobile app. We push it, push it, push it, push it. Any other questions? Let me look at the chat. Approximately how many families are receiving workforce assistance in Durham? Lord, I can get that number for you and I can send it to you. Any other questions? Okay. I'll pass it over to our Medicaid buddies.
Hello there. Hi, my name is Nancy Santos. I'm the program manager for the Change team. And today myself and the supervisor, Erica Maddox, will give you a presentation about Family and Children Medicaid. She will go through the slide to explain to you how a person is able to apply and what is Medicaid as well.
Hello, everybody. Again, my name is Erica Maddox. I'm just trying to get my screen pulled up for you. All right, please let me know if you can see my screen. Awesome. All right, so I'm gonna give you some information regarding Family and Children's Medicaid. I won't delay us. I'll go ahead and get started with the slides. So what is Family and Children's Medicaid? So North Carolina Family and Children's Medicaid, it is a federal and state program for individuals and families who qualify by meeting certain financial and non-financial factors. Some of those eligibility factors can include household income, the number of people in the household, the age of the children, as well as the tax status. When we say tax status, if they are a dependent, if they're a non-filer, if their parents or their caretaker is filing taxes. So all of that is information that we would need to know to determine eligibility for Medicaid. The policy is governed by federal and state regulations. The local county DSS is responsible for implementing the programs within guidelines set by federal and state laws. Programs can range from full Medicaid programs for caretakers of children under the age of 18, for children under the age of 21, and for pregnant women. And they go all the way through limited programs such as family planning, as well as breast and cervical cancer programs. So some various ways to apply for Family and Children's Medicaid. You can submit a paper application that can be mailed to our P.O. Box 810 Durham, North Carolina 27702. Or like Ms. Chambers mentioned before, we do push the mobile application. We get it in real time, so you can submit that via the mobile application, or you can drop it off here at the agency in the drop box that's located right out front. It's a big gray mailbox that clients can put that information in. Another way is via telephone. Clients can make an application over the telephone via the number that we have listed here. Interesting, very good thing that the state has provided to us is the voice signature response functionality within our system. In times past, when a client has provided a application via the telephone, the caseworker would then have to mail them out a signature page, wait for that signed application to come back before they can proceed. However, the client can, through our voice signature functionality, can provide their signature via voice response, and that just prevents the delaying the application processing. Another way is through our ePass system. A client can go online and submit a Medicaid application through our ePass system. They can also come in person to our local DSS office here at 414 East Main Street and complete an application Monday through Friday, 8:30 a.m. to 5:00 p.m. They can submit an application via our fax line. We also receive applications from the FFM, the Federally Facilitated Marketplace. And what happens is when an application is submitted to the marketplace, if they deem or see that a client is potentially eligible for Medicaid, then they will then send that over to the local DSS office. However, if we determine that a client is not eligible for Medicaid, they then can go back to the federal marketplace to see if there is a health plan that they are eligible for through the federal marketplace. Another thing that I would like to mention is that when a client does apply for Medicaid, that they do have the option to apply for what we call retroactive coverage, which is 1, 2, or 3 months of coverage prior to the month that they make that application. So for an example, if I was to come in and apply on April 1st, I could potentially receive medical coverage for January, February, and March if I had a medical need in any one of those months. So that is important to note because they do have that option available to them. So some best practices for completing the Family and Children's Medicaid application. You want to make sure that that application is signed. You want to make sure that the information is legible. If someone is completing the application and signing the application on behalf of another individual, you want to ensure that they do complete what we call an authorized representative form. And what that form does is just give us the authorization to speak to somebody else other than the actual individual that is receiving those benefits, to give them information, to send information to them, to send information to them on their behalf. If someone else, if the client will have someone calling in and inquiring information on behalf of the client. Again, like I said, you want to make sure that you have that authorized rep form completed. Also ensure that all members that are in the household, whether they are applying for Medicaid or not, is listed on the application. You want to indicate who is applying and also indicate what the relationship is between the different individuals.
Hello. Yeah.
I believe somebody is off mute.
Yeah. Please take me off with it. I've already got it fixed, and this is about
Mr. Newcomb, if you could mute your mic for me, please. And so you also want to ensure that a working telephone number is listed on the application. That is something that we run into a lot, where we run into hiccups and can delay the application processing time. If we have to reach out to the client, if we do not have a good working telephone number on the application, then it can delay because we're unable, that option of calling the client to receive the information over the phone has been eliminated, and we have to mail out notices, mail out requests, and that can just delay the processing time. And access to this application in the authorized form, you can access it by clicking on the actual picture within the presentation. So just some other information here. When completing the application, and if applicable, the client would want to make sure that these different verifications they're included in their application and uploaded. You can upload documents on the ePass website, as well as through the DSS mobile app, and the links are here on the slide. But things like proof of residency, proof of other insurance, because you can have another insurance like Blue Cross Blue Shield and still receive Medicaid. Medicaid would just be the secondary insurance. Proof of disability, proof of citizenship, proof of social security number, if we need that information. You want to make sure that you either submit it with the application or upload it, just to delay, prevent delaying of the application processing, and also to prevent your application from being denied if we do not receive this information back. However, if we cannot get in contact with the client over the phone, we do give 2 separate opportunities for the client to provide that information. We will mail a notice out requesting certain information that we need, and give the client 12 days to provide that information back to us on 2 separate occasions. And again, clients can submit documentation via the ePass. They would receive an email notification to inform them when there is a change to their application. Clients can also opt to receive email notifications, which will allow them some notices to be sent to them electronically. The client will receive an email or a text message advising them if they have an e-notice. So that is a lovely feature that we have access to. And then just some basic family and children's Medicaid requirements. You must be a U.S. citizen or provide proof of eligible immigration status. An individual must be an alien with lawful immigration status in the U.S. Undocumented individuals may potentially be eligible for emergency medical services only. There's 2 different types of emergency medical coverage. One being the treatment after the sudden onset of a medical condition, meaning if something happens, someone is in a bad accident and they have to go to the emergency room. Once they have received treatment at the emergency room for that injury or that emergency room visit, they can then come and apply for emergency services if they are an undocumented individual. And the other type of emergency service is labor and delivery. And labor and delivery eligibility is determined here at the local DSS office. And then we have a partner agency group, which is called Alliant, which determines eligibility for the sudden onset of that medical condition, the first type of emergency coverage that I mentioned. You must also live in North Carolina and provide proof of residency and have an intent to remain in North Carolina. You must have a social security number or have applied for one. The exception to this is what we call auto newborns, and these are newborn children whose mother was receiving at the time of birth. So a newborn child, if their mother was receiving at the time of birth, gets the first 13 months of Medicaid, just because they were born there and they automatically meet those requirements. So they get the first 13 months of Medicaid. However, when they come up for their review, they are required to provide a social security number in order to continue to receive Medicaid benefits, as well as meeting the other requirements. Another basic requirement is meet income limits. So income limits vary depending on the Medicaid program as well as the age. I know for what we call our MIT coverage, which is for children, they do vary between age. You have your children that are from 0 up to 1, and then 1 to 5, and then 6 and above. So there's 3 different categories there for our children. And then after that is the 20 and 21-year-old category for what we consider our children categories. And then we have family and children's Medicaid recertifications. So clients receive a state notification that they have a renewal approaching 6 months prior to the renewal date. Clients should report any changes to the household, such as who lives in the home, income changes, changes in tax status, if someone becomes pregnant or disabled, or similar information that may affect eligibility within 10 days of becoming aware of this change. If a client receives a request for additional information, you want to ensure that information is returned by the specified date. And you want to ensure that private and mailing addresses and phone numbers are correct with the local agency. And so eligibility determination, we must complete that by the first day of the new certification period. So for an example, if a client's Medicaid is set to end today, February 28th, then ongoing eligibility must be determined and benefits renewed by tomorrow, March 1st, 2023, so that the client has no gap in Medicaid coverage. And one of the ways to ensure that we do that is to ensure that we get all information that we need, any changes reported timely and within that 10 days. So if a client is over the income limit for Medicaid, there are some options available. One of the options is meeting a deductible, kind of similar to if you have regular insurance or, Blue Cross Blue Shield, Cigna, and you have your yearly deductible. Very similar to that. You can use paid or unpaid medical bills as long as they incur within the 24 months, the prior 24 months. Eligibility is given in any or all of the 3 retroactive months as well. So retroactive coverage is an option here, or you can receive it in 6 month increments for ongoing coverage. And the deductible refers to the amount in medical expenses the applicant or beneficiary must incur before he or she can receive Medicaid benefits. Once those bills or those medical expenses have been incurred and they equal the amount that we have determined based on the income, Medicaid benefits can then be released as long as all the other eligibility requirements are still being met. And again, you can use paid and unpaid bills as long as they happen within the previous 24 months. Another option is the Affordable Care, and you can visit that website at healthcare.gov, and that link is there for you. And then we have North Carolina Medicaid Services, North Carolina Managed Care, which is North Carolina Medicaid Services which are now offered through a health plan. So a health plan is a group of doctors, hospitals, and other healthcare providers. They work together to give you the healthcare that our clients need. This includes physical health, behavioral health, and medicine. Some health plans provide added services like programs to help an individual quit smoking. Health plans have a provider network. Most people receiving North Carolina Medicaid must get healthcare services from a standard plan. Individuals with needs related to mental health disorder, substance use disorder, or traumatic brain injury, those different types of things, you may qualify for a tailored plan that serves your particular county. Some people do not qualify for a health plan because of the type of healthcare services that they need, and they are enrolled in North Carolina Medicaid Direct. And you can go to the North Carolina Medicaid Direct Services and go to the North Carolina Managed Care website to get more information regarding managed care. For Durham County, health plans that serve Durham County would be Alliance Health, and that is for the tailored plan. AmeriHealth, Carolina Complete Health, Healthy Blue, United Healthcare, and WellCare. Those are the main health plans, and then we have the North Carolina Medicaid Direct plan. To obtain help with choosing or changing the health plan, clients can contact the enrollment broker. One thing that is important to mention is that the local DSS office cannot enroll an individual into a health plan. They would have to call the enrollment broker in order to get assistance with that. And then we have some other useful links here, similar to what Food Nutrition and Ms. Chambers and Ms. Fuller shared. We have the DSS FEI website where you can obtain more information and also get some helpful information regarding Medicaid, food, nutrition, and work first. You have the ePass website where clients can apply. You have the Family and Children's Medicaid policy link here, the DSS mobile app, and some policies, please remember, they are subject to change, but as of right now, this is what we are going by. So we have that link if you would like to read up on and get more information regarding Family and Children's Medicaid. And then the DSS contact information, we have Ms. Santos, which is our Change Team Program Manager, and then we have the other supervisors within the Change Team for Family and Children's Medicaid. We do have 2 application supervisors, and then we have 4 recertification supervisors here. Their names and emails, addresses, if you need to get in contact with any one of us and you have any additional questions, please feel free to reach out. And then we also, again, have the Medicaid applications phone line if someone would like to make an application via the telephone. And do we have any questions?
Yes, so Erica, there's a couple of comments here in the chat. The first one is pertaining to, it says for DSS staff, do you have any suggestion for how homeless housing providers and other service providers on the call could support the good work that the DSS team is providing to people in need of the Durham community? So part of that I will say is, if an individual is receiving any of our services or benefits and they're transient and they move from one place to another, they definitely should always contact their workers to let them know about where they're at, because sometimes if we are unable to reach someone and we're sending them some notices, their benefits could be terminated because of that. And with regard to food stamps, and Latoya and Maria Fuller could speak more to it, they are mindful of individuals who are homeless as well. In addition to that, here in Durham County, we do have other services. So we do have crisis services. You would contact the 919-560-8000 to get some additional, to be linked to the crisis services. And sometimes they're able to help with paying of utilities, the rent, and some other services as well.
And to add to that, case managers that are working with homeless individuals, it would be helpful as well, because some people may need assistance with completing the application. So just ensuring that that information and the verifications that are needed to complete applications for benefits, various benefits, is received and also received timely. That would be a great, a wonderful support to our DSS staff as we're processing these applications. And then also, if the client is willing and would like for that particular case manager to be an authorized rep to speak on their behalf, to turn in information, just ensuring that the authorized rep form is completed and submitted. That way they can act on as a liaison for that particular client. So both of those things, as well as what Ms. Santos mentioned, would be a great support to our DSS team as we work through processing any applications or recertifications for benefits. That would be a great assistance.
And lastly, the QR code, that's very helpful. We have that as both Latoya and Maria provided. You have that, and we also have it for some of the other programs as well. So those are where you could get some additional services as well. Okay, any other questions regarding that question? Okay, now the next one, it says, with the end of the COVID public health emergency, everyone on Medicaid would need to be recertified for eligibility. What planning is happening at DSS to ensure that it is going to be able to process all of the recertification that are going to be needed in the next few months. Well, thank you for that, because that is a concern that all 100 counties here in North Carolina have. So we have been working hand in hand with the state in terms of what they're referring to the unwinding of the public health emergency. We are following the guidance of the state. The state is working with us to let us know what is needed. Currently, what they have asked us to do is to, they are going to automatically enroll for this month a lot of the research, which allow us then time to be able to process it. So this is an ongoing matter that is being addressed, and it's a collaboration between the state and the counties. Here at the counties, we do have different meetings to kind of look at what is in the best interest, how do we unwind and continue to provide the services to these individuals, as well as dealing with our staff as well, because our internal staff is also affected with all these changes. And as most people know, we it's a challenge sometimes. We do have some vacancy with the max exodus that has happened within the last couple of years. So we're looking at that as well. So we're working hand in hand with the state to ensure that individual will continue to receive the benefits, and anything that is not being able to be completed by the county, the state would update as well. Erica, anything else you would like to add to that?
No, I think that that pretty much covers that.
Okay. Then the next question say you reference managed care, tailored care, and standard care plans. Would you clarify once more who needs to go into the various plans?
Mm-hmm. So managed care is just, when I say managed care, that is just referencing the name overall for North Carolina, the Medicaid programs and the health plans. Individuals who qualify for a standard plan would be most families and children, pregnant women, individuals who are blind or disabled and do not get Medicare, federally recognized tribal members, or others who qualify for services through Indian Health Service. One of the things that I will say as far as the tribal members, that is really not applicable to Durham County, because the tribal members, that is not one of the health plans that is that covers Durham County. As I related, we have those main 5. Who qualifies for a tailored plan? That would be individuals who get what is called innovations waiver services, individuals who have had traumatic brain injuries and they have waiver services as well. People who may have a mental health disorder, a substance use disorder, intellectual development disability, or a traumatic brain injury. That is specifically for that tailored plan. And I will say it just depends on the person's specific situation. And when they call the enrollment broker, will help them through asking various questions to ensure that they get placed on the right plan.
Thank you. The next question is, can adults unaccompanied by children also qualify for Medicaid? If so, what are the limits?
So can adults unaccompanied by children also qualify for Medicaid? They can, but it would be that family planning, primarily that family planning plan, which covers various birth control methods, screenings and treatment for sexually transmitted diseases. That is primarily what the family planning plan covers, because in order to qualify for full Medicaid as a parent or a caretaker, you do have to be the parent or a caretaker of a child underneath the age of 18. So if you do not meet that requirement, let's say your child is 19 or 20 or 21 or older, or you just do not have children, then you would qualify for family planning if we are talking strictly under the family and children's umbrella.
Okay, thank you for that. And the last question that I see here is, are there specific DSS benefits that people who are experiencing homelessness can access while homeless that are not available to people who are not homeless? So for me, that is, we just determined there is nothing that is totally just separate. Crisis services may have some additional services for homeless, but we just service the individual, and based on their eligibility, make sure that they get the benefits that they're entitled to. With food stamps, I'm not too clear. I don't know if Maria or Latoya want to add to that in terms of homelessness, and if someone, because there's different definition of homelessness. Someone could be homeless and living with someone could be homeless and sleeping on the sofa or on the street, stuff like that. But from my understanding, we really just determine benefit based on the need and what that person is going, and there's not a separate type of benefits for them.
And that's correct,
Anyone
Nancy.
else?
That's correct for food and nutrition as well. We don't have separate benefits for the homeless. We do evaluate each individual household.
And that would be the same for Medicaid as well. It's not it wouldn't be separate benefits. If they meet the basic eligibility requirements, then they can potentially receive Medicaid services. If they do not have an address, they can use the agency address.
Yes, thank you. And they could use the address as well for FNS and to get their mail there and get the EBT card as well.
Okay, do we have any, I don't see any additional questions in the chat. Do we have any additional questions? All righty, well then I will turn it back over to you, Mr. Smiter.
All right, thank you so much, Erica. Thanks everyone for participating. I am very grateful, and we will be posting the recording of this session on the durhamcoc.org website for future use and getting the word out to people who perhaps wanted to attend, but their schedules didn't allow. A lot of helpful information, really, as well. Encourage people to access the slideshows, the various presentations that Latoya and Erica and others on the call from DSS made available to us. I think lots of great information. Again, we appreciate your work, your partnership with us. Certainly DSS is, the employees that work there are very important partners in the work of helping us address the needs of people who are experiencing homelessness and other low-income people in our community. So we appreciate your work and support you in that good work. So thanks for the good work you're doing. And with that, we will end the session. Thanks again, everybody. Enjoy the rest of your day.
Thank you.
Bye-bye.
Thank you.
Welcome.
Bye-bye.
Thank you. See you all.